Good morning, and thank you for joining us for continuation of the COVID story. And it'd be really nice when we get to a point where we can take all off topics and not have to focus on this. But until that time, we're going to make sure that the people of New York are fully apprised of what we're doing to fight this pandemic and also reinforce our priorities. And our priorities will continue to be keeping kids in school, making sure that we get people back to work safely, and to reopen New York safely. So we're continuing our focus on this, and we all know the answer is getting more people vaccinated. Here's our update. Our daily infection rate stabilizing. If you look at the numbers, 2.58. Statewide, it's good. There are some regions of our state which could be doing better, and we're watching those closely to see what's going on, and also deploying more pop-up services to those areas, particularly the North Country. New York City, quite extraordinary when you think about this had been the epicenter, and I see I take daily walks around the city, incognito, of course, and I do see so many people wearing masks and people really adhering to, when I stop in a restaurant, being asked to show that they've been vaccinated. So I believe that's one of the reasons we have such great numbers in New York City. And I will also say, when I'm speaking to people elsewhere, this is also a selling point for the city of New York as we bring back people to here to their jobs, but also to our entertainment venues, our theater, our concerts, and let people know that this is a very safe place to come. And when we start getting the international tourists back in November, I think this is going to be another reason they're going to come to New York City and New York State, opposed to others. Our New York City numbers, as I said, are very good. Manhattan 1.1, that's great. And even Staten Island's doing very well, in particular, given that they had been quite a bit higher in the past. So we're making good progress there. Daily hospitalizations. We have to make sure that we focus on this. It looks like a little plateau, but I'm not going to declare it a plateau. I want to watch those numbers more closely. But the numbers are basically the same as what they were last week, and sadly we lost 38 people to COVID. So this is still deadly serious, and we're still at a point where we're seeing hospitalizations, 2,200. There's a lot of people who thought they were just going to go about their daily lives, and they contracted the virus, and now they're struggling and suffering in a hospital, and our prayers go out to all of them. Also, our regional hospitalizations, we're still in a good place. We're watching to make sure that ICU beds available is always going to be around those numbers. Hospital beds available have been stabilized, and that's important. Any area of the state that we see a lessening of the availability, we will deploy people to help out. We'll find out what's going wrong there and what they need from us, because this is really important that people have the beds available to them in the event they need to be hospitalized. So we're going to continue our vaccination, our school updates, our vaccination, daily vaccination update as well. The numbers are looking better. I'm really pleased to see this, that we now have 18 and older, we have at least almost 83% last week, and now that has gotten even higher. So we're getting in the right direction. Still not happy with our young people, and I'm not sure what other argument I can make to the parents of these 12 to 17-year-olds other than, what are you waiting for? Your kids need this. Your kids needed this vaccination in order to enter kindergarten, and they should be getting flu shots. And there's a lot of other ways that we can protect our children, and I really am just beseeching parents to do what's right for their kids and not let them be one of those children who end up in a serious condition in a hospital, or even worse yet. So we're going to continue focusing on the young people, and that's why I'm continuing our pop-up sites. Well, as I mentioned, we'll have over 120, but I'm adding 20 more pop-up sites. And this draws a lot of attention to it, makes it a lot easier. There's no reason why parents can't sign in a permission slip and get it to the administrators and let the kids get vaccinated while they're even at a school or a community center. And that's been successful. And I thank all the elected leaders. I mean, there has been such a unified voice of all the elected officials that we've reached out to and said, we'd like to do this in your community. And it's been very, very encouraging to see the support we've had there. We've always talked for the last 5 weeks I've been on the job about the breakthroughs. Watching those closely, hospitalizations are stabilized, but our cases are 0.7. Now, you need to know that it's truly the unvaccinated people that are populating our hospitals. I mean, unvaccinated people have a 10 times higher risk of developing severe COVID versus someone who's not. So the focus should not be on these breakthrough, but it's a reminder why we are still wearing masks and why we're still being careful, even people who have been vaccinated. And vaccinations have really been established to be proving to be 90 to 95% effective. So another argument why people should be vaccinated, and we'll watch these breakthroughs very closely, though. We've also made sure that we have the boosters available. I mentioned this last week, and now we can get them out there only for Pfizer. We have to reinforce that. I have to continue waiting. I was at J&J back in March, so we're hoping that those approvals come through soon. We know that the CDC has recommended them for people who've had their vaccine at least 6 months ago, 65 and older, living with medical conditions, high-risk settings, or work in high-risk settings as well. And that's important because that's a lot of people in that category. And I've already was speaking to clergy this morning, talking about how we can bring pop-ups to their churches again and their religious facilities to make sure it's a lot easier for their members, particularly the older ones, to get the booster shots as soon as possible. Really important. Again, we're confident about the supply. This is something I've had conversations with our manufacturers about and our pharmaceuticals to make sure we have them available. So everyone who's in one of these occupations, and the CDC is helping us clarify who these individuals are, first responders, congregate staff, education staff, food and agriculture workers, correction workers, postal workers, transit workers, grocery store workers. These are just some of the examples of high-risk occupations. But I'm also hopeful that this will actually be broadened even more because we know in New York City, people are in situations where they're getting to their job and they're in a subway or on a bus, and we're having conversations about a more liberal interpretation of this, but this is what the CDC is recommending right now. So far, we've had over 200,000 boosters administered when this started for the people who are immunocompromised, and we want people to know that there's a website out there, ny.gov.boosters, if you want to find out where you can get them and your eligibility as well. So we're focused on the booster shots intensely. Again, my number one job as governor is to keep the people of this state safe. And that is why we were very firm in adhering to the vaccine mandate that as of Tuesday, actually midnight on Monday, Tuesday, healthcare workers all across New York in health hospitals and nursing homes were required to be vaccinated. It was the right thing to do. I will stand with that. It was hard to do, though. It's hard to force people to do something that you truly wish they would do voluntarily. But I kept focusing on the people who, when they get sick, someone's in a car accident, they present themselves to a hospital, or an expectant mom is making sure all her family members are vaccinated so when the baby comes home that the baby will be safe, and yet they're not sure whether or not the person taking care of them, physically close, in charge with their safety and their care, they need to know that that person is vaccinated as well. That is something we owe the people of our state, and that's why we held firm on this. So basically right now, all healthcare workers must be vaccinated for people who work in hospitals and nursing homes. And the vaccination rates are going up. I took office August 24th. It's hard to believe. 77% of people in hospitals were vaccinated. That number is now 87%, but that number is going to go up because those were the numbers that those are fully vaccinated, but they met if you see the number at the top, it's 92%. The 87 are people who have had fully vaccinated, which is great, but we needed to have people vaccinated with at least one dose by the 28th, and that is the number we hit was 92%. You will see that number go higher quickly because what we're finding is, as more people are furloughed or suspended, that number is going to go up. But that was the exact day that we put the mandate, the effective date in place. And I have to say to all the healthcare workers, and especially those who are a little nervous about this and anxious and didn't do it up until recently, I thank you for doing what was right. I thank you for caring about the people that look to you for their health care, their lives, the attention you give them. And this is truly a profession that I have such respect for, particularly after seeing what they did over the last year, starting in March of 2020. Extraordinary work, and I continue to honor that and respect that. And I believe that this is the right thing to do, and I commend everyone who stepped up and have been with us throughout. And I can only do what I can do to encourage more people to realize the powerful feeling it is to help people in their greatest time of need. And I want to attract more people to go into this profession and receive the training they need, whether it's a CNA or whether it's a fully licensed nurse or doctors. There's so many careers in the whole ecosystem around healthcare. The people of your state look to others to take care of them, and this is something I want to make sure that we're encouraging. On nursing home staff, similarly, we hit the 92% on the exact date of the mandate, and that's up from 71% when I first took office, and let people know that this is not something that I'm going to deviate from. I'm going to hold firm, and so if you're waiting, what are you waiting for? Because we're not changing our position on that, which has been firm, and truly the only state in the nation that came out and mandated this, but we were hardest hit. Everybody knows somebody who had COVID or succumbed to COVID. This is personal for us as New Yorkers, and that's why we wanted to make sure that we may have been first hit, but I want to make sure we're the first ones who declare victory over COVID, and this was an important start. The vaccination rate for adult care facility staff, that goes into effect October 7th. That'll be home health care agencies, hospices, adult care facilities. And so the numbers are trending upward, and I think we're going to hit even higher numbers. I'm sure we'll hit even higher numbers as October 7th rolls around. So a lot of people had opinions on this, and I am so grateful for the support we received from, for example, the Nurses Union. I spoke to Pat Kane, the executive director of the New York State Nurses Association. I called so many hospital leaders over the last few days to just touch base, see how you're doing. Do you need some help? Are you going to be okay? And it was universal. The support we received from the hospital leaders, the representatives of the unions, the nurses in particular. I thank them for having the courage to stand up for their members who were vaccinated and to encourage others to follow suit. So thank you. I just want to convey my deep gratitude to all of you who did the right thing. And in order to mitigate any potential effects on delivery of health care in our state, we had to take some steps. And we were bold. We let people know that we were preparing to amass an army of people if necessary, and part of that was even just bringing the potential for the National Guard, which we did not have to deploy. We had thousands of student nurses that were available to be deployed and anxious to get some hands-on experience, bringing in people whose licenses had lapsed because they had retired, getting them available. So one more step we took this past week was an executive order that suspended for 30 days the requirement that there be pre-authorization of the medical care for insurance purposes. And why does that matter? Because there are so many licensed healthcare professionals, including doctors and nurses and others, who spend a lot of time having to do this paperwork when in fact if there was a crisis, they could be deployed by their hospital to actually be on the floor and help people. And that's what I want to make sure, that we just broaden the available pool of people to help solve this if we got to that point. But I would say we did not see that. We did not see a situation. We still have our 24/7 operations center, and I thank Catherine Garcia and our entire health team for putting this in place. I mean, we knew what we need to do. We've been through crises before. I've set up operation centers to deal with all kinds of crises in my various roles I've had as a public official. And you get that together. You let the people affected know that if they need help, you call and we'll help deploy people. So we work with them to let them know that we will help them with whatever they need. We found that not a single healthcare facility reported being closed since the mandate went into effect, and making sure that they know that, continuing forward, we're going to keep this maintained and to deploy the resources if they need them. And I'll also be briefing our congressional delegation tomorrow on this to make sure we've answered all their questions and have been in regular contact with our state leaders as well. So here's the message. We got through a difficult week. It wasn't easy. I thank people who stepped up and did the right thing, and we're going to continue monitoring this. And my number one priority, again, I'll keep saying it because it is so true, protect the people of this state. protect their access to health care, and be there to lend the support in any situation where that is compromised. We've come too far, my friends. We've come too far. We cannot slide backwards. We're getting through this. We're getting through it together. And I thank everyone who really just understood the necessity of the mandate, who are willing to help their fellow New Yorkers. And that's what I love so much about this state, the willingness to do whatever it takes to take care of our fellow neighbors. And